Kris Acerate discovered the National Health Service Corps through his mentor and former executive director when he first started working as a medical provider in his community health center.
I learned about our loan forgiveness program through our former executive director, Dr. Diana Shaw. Whenever I first was able to obtain a job as a medical provider for Lānaʻi Community Health Center, she mentioned that option, and so I went ahead and applied for it. The application process actually took about a few hours, I would say. It didn't take too long. I just had to make sure that I had all my credentials in line, such as like my NP license, APRN license.
Working in a shortage-designated area, his primary concern was ensuring urgent referrals could be handled promptly, especially with limited medical providers available.
I know with the limited amount of medical providers that's in the facility and in Lānaʻi as it is, just wanted to ensure that all patients have the proper care. And if they needed to be shipped out appropriately, that they're shipped out as soon as possible.
Originally from Oahu, moving to a rural area was a big change for him, but one that he now considers one of the best decisions he's ever made.
I felt like I adjusted just fine because being in the city and living in the city, I wanted to have a change up and try something new.
His experience working as a nurse practitioner student at the same facility made the transition even easier, as he already knew how to collaborate effectively with the team.
This was my last clinical rotation, and I absolutely was able to collaborate well with the employees here. And I feel like with that, it made it so much easier to do well in such a rural community setting.
Looking back, he wishes he had known about all the different loan repayment options available, not just the one he chose. In the end, working at the Lānaʻi Community Health Center for 3 years was a huge plus, and he encourages others to explore similar opportunities.
The best story that I ever learned is that knowing first off about the loan program, because that honestly, giving your time for the 3 years in such a wonderful facility as this one that I'm working at, Lānaʻi Community Health Center, it's such a rewarding thing for me. And I hope that for future medical providers and providers that are not even medical, that they know about this program, what they're able to apply for.
His advice to others thinking about applying for the program? Simple.
The advice that I would want for anybody that applied for the program is go for it. I know it's a different thing to be in a rural setting, but the advantages are endless. And for the fact that you could give 3 years of your time to working in a rural facility and able to assist with your financial means for your loan is awesome.
For more information on how you can support or become a part of the NHSC, visit nhsc.hrsa.gov.